Expand design, a roomy cabin, dual-tone interiors, 15 smart utility spaces, and a large boot space, all there to expand your life. Welcome to Easy Space.
Several trade unions attached to the health sector commenced a strike action today. This strike action resulted in the activities of state hospitals being hampered. The trade unions commenced this strike action citing 5 demands, including the granting of salary arrears in accordance with Circular 6 of 2006, the implementation of the 5-day work week and limiting night shifts to 2 days. The strike action commenced at 6:30 this morning and will continue for 48 hours. 21 trade unions representing 27 grades of health workers attached to the Joint Trade Union Committee are taking part in the strike action. Ward clerks, food inspectors, housekeepers, orderlies, elevator operators, transport operators, attendants, cooks and other minor staff are taking part in the strike action. Operations at the National Hospital in Colombo were disrupted due to the strike action. The assistance of personnel attached to the Civil Defence Force was also sought to maintain an undisrupted flow in the activities at the National Hospital. Despite the disruptions, we have managed to put them aside and carry out our services towards patients as usual. Activities at the Colombo South Teaching Hospital too were disrupted by the strike action. However, minor staff who do not support the strike action were seen taking part in hospital activities. We have deployed personnel from the Civil Defence Force. Patients are being admitted. There are lapses at the clinic, but the surgeries are taking place. Activities at the Karapitia Hospital in Gaul were also disrupted. The assistance of the Sri Lanka Navy has also been sought to maintain operations at the OPD. All emergency surgeries are taking place as usual. Planned surgeries have been postponed. Operations at all the base hospitals are taking place in a successful manner. The Civil Defence Force and the security personnel are assisting us. Activities at the Hingaragoda District Hospital too were hampered as a result of the strike action. Duties of the minor staff were performed with the intervention of the Civil Defence Force personnel. The Civil Defence Force also assisted in maintaining operations at the Anuradhapura Teaching Hospital as a result of the 48-hour strike action launched by health workers.
We hope
to seek the assistance of the Civil Defence Force as well as the Sri Lanka Army. We will continue with the operations at the hospital.
The Joint Trade Committee meanwhile staged a demonstration opposite the National Hospital today.
Health workers who reached the location where the Joint Trade Union Committee is staging a fast, urging that demands be met, later commenced a protest march. However, their march was restricted to the Lipton Circus. They were informed that they will be given an opportunity to discuss their issue with the President through the intervention of the Minister of Health. Senior members of the Joint Trade Union Committee informed their fellow colleagues of this announcement. However, some members opposed this move. Though there was opposition by several members, the Joint Trade Union Committee decided to stop their protest march.
Now, the Ministry of Health announced that a discussion is underway with the President on the issue. Additional Secretary to the Ministry of Health, KAS Kiragala, said that the Minister of Health, the Secretary and several other health officials are taking part in the discussion. Meanwhile, the General Secretary of the Joint Trade Union Committee, Samantha Korla, said that the strike action will continue. Minor staff at several hospitals on strike, citing several demands. Doctors in the Polonnaruwa district staged a token strike. Government radiology staged a week-long work to rule campaign citing 7 demands, including allowance increments. Midwives staged a sick note campaign against nurses being given labour room training. Mothers inconvenienced by nurses strike at the Castle Street Hospital. Medical officers of health in Newra earlier on strike in protest against interferences by a minister. One-day strike launched in 6 provinces by health sector employees in professions supplementary to medicine, citing 6 demands. For your attention.